we're doing some important talk first on which chip is the best. I'm glad to be here. I have an awesome JFO, Just Find Out sponsor. Good ideas that you can think about for your office, for your patients, for your team. We have Dr. Brad Eli here with a product that helps patients with tension headaches, mild trauma, the stuff that we have trouble figuring out. So I want to welcome you, Dr. Brad. Share with our Dental Nachos audience what you do, your background, and how you help dentists.
Great. Thanks so much for having me. In this era of COVID, it's all about what can we do for our patients and how quickly can we do it. So I am an expert in facial pain and the treatment of facial pain, including temporomandibular disorders, etc. And been doing that for 30 years after completing a postdoctoral training program in it. So in the years that I was in early practice, working in pain centers at university hospitals, I didn't have a dental operatory. And so I was running into patients who had jaw pain problems and needed oral appliance therapy, but I didn't really have the mechanism in place that made that easy to do. So, as we all were taught or not taught, that when somebody has jaw pain, they usually will be given splint therapy or some sort of oral appliance therapy as a treatment. And the whole issue of grinding their teeth, not grinding their teeth is, a conversation for another time. But so in the long story is that I was seeing patients referred, and the story went months before, after a dental procedure or after a whiplash injury or after some sort of event, they started having jaw pain. And they had really kind of been told various thises and that's, including, oh, go to the store and get, an over-the-counter device. And there was no monitoring, no following, no nothing. And so I said, well, why don't I just make a little something to get in their mouth, kind of like an ace bandage put on a sprained ankle. Yeah. So getting them into treatment at a speed.
I like that ace bandage on a sprained ankle. I've been the recipient of using ace bandages. I think it's a great way for people to think, hey, you have this challenge, you have this pain, here's something to make it a little bit better now while we figure out the long-term thing. So great example.
Exactly.
Share with me, what's the best website? People are watching this saying, I want to learn more about this. What's the best?
So the word speed and the number 2 and the word treat all in one.
Speedtotreat.com. Speedtotreat.com. Okay, great. I know I'm very engaging, but some people will check out after 3 minutes to Dr. Nacho. So I know speedtotreat.com. Okay, continue. So we have the bandage that practitioners could use. How do they implement this with their patients? Let's say it's me, patient calls me up after this or texts me and says, I have tension headaches, I have this, I can't see them because of COVID. How would this help them?
The classic person would say, since this has all started, I've been grinding my teeth like a mad person and my jaw is killing me in the morning. They're currently not wearing anything. So you would say, go on the website. So you would have a televisit. So that would be your initial televisit. And then you would say, I need you to go onto this website and buy this box. And in this box, they will have literally follow the directions. So in this box, we have things that I, as an expert, wanted to see. So I didn't need to replace the Boil and Bites that were available over the counter. What I needed to do was give people a plan, a tracking mechanism, a hot and cold pack, and a little oral device. So it's put together in a packet where they, if they follow the directions, can go from this to this.
Okay.
That fits in their mouth at nighttime, gives them a surface, and then they will follow along keeping track of their symptoms on a day-by-day basis. So then Dr. Nacho has a reason to call them 2 weeks later and say, I'm following up. You had a problem. We instituted a care plan. Are you following the care plan? Is the care plan working? So one of the things that I really wanted to make sure that anything that we put out into this marketplace, I wanted to make sure that it wasn't just a blind, hey, go get something and good luck with it, right? So this ties the patient to you, ties the patient's follow-up to you, and then after a 4-week period of time, they're done with our Speed to Treat home healing kit, and then they become a more clear, do they have a long-term grinding problem that you now don't have to convince them of because they have ground a hole in the surface of this? Or are they asymptomatic? Like, so, you know, when I used the analogy of the ace bandage for the jaw, I always say to people, you know, when you sprain your ankle, the orthopedic surgeon doesn't demand to see you and doesn't put orthopedic shoes on you for the rest of your life because you sprained your ankle. So Speed to Treat is designed to immediately impact a symptom, monitor the outcome, and either stratify you into a group that needs more help or stratify you into the all better group.
I mean, that is really awesome, Dr. Brown. I think you've developed something that, I mean, I'm interested in as a practitioner. Just listening to my team, please tag my brother, because as general dentists, you know, we get asked so many questions, not even all related to dentistry, but this is related to dentistry. We just don't have a lot of confidence in training and treating oral facial pain, but it's great for us to be able to do the first type thing and then get them to someone like you if they're in that needs more treatment, make them feel like we can do something. I mean, that to me is awesome. So speedtotreat.com. What's the cost of the package in general to the patient?
We have around $100.
Yeah, so
100 to 150. So it depends on what they get. If they get a basic, it's like a little less than. If they get all the little bells and whistles, it's more than.
It's a reasonable option to explore, and JFO just find out about your jaw pain. You know, people get rashes. They use $50 worth of different creams trying to make it go away. So that impacts your life. So I think that's just fantastic. So if people want to learn more about it, they can go to speedtotreat.com. If someone wanted to reach out to you and your team, who would they reach out to?
They could get directly to me if they wanted. brad.e@drbradeli.com, or if it's related just to the product, it would be Ann at quicksplint.com.
And a quick film. We'll put all that in the comments. And now, before we wrap up, I want to talk about our most important thing. Tell me about that chip near where you're at that you said is a fantastic chip. Where are you in California?
Well, there's a chip that's made out here that I'm going to get a bag of, and I'm going to get your address and send you a bag of, and you'll be hooked. You'll be hooked.
You're going to put that right to the top of the order for today. So I want those chips. Well, thanks, Dr. Brad, for being an awesome key resource and sponsor. This is exactly what I want to do, whether it's during the COVID crisis or regular times, is to bring dentists good ideas to find out about as a practice owner, having this in your toolkit for you to just be able to recommend to your patient and monitor at home. Or you said some utilize it inside of their offices, correct?
Right.
Patients. And these patients have pain. So thanks, Dr. Brad. Reach out to you, speedtotreat.com. Hang around with us. Dental Nacho verse. Enjoy the rest of your day. You hang around with us for a few minutes, Dr. Brad.
All right. Thanks so much.